When you think about women and health, it may come as a surprise what the biggest threat is to women today.
I would probably guess between breast cancer and lung cancer.
Is it diabetes?
Heart disease or cancer.
Those are all pretty good guesses, but the #1 killer of women in the U.S. today is cardiovascular disease. In fact, more women die from heart attack, stroke, and cardiovascular disease than men, but many women don't know they're at risk. According to an American Heart Association survey, only 13% of women considered heart disease their greatest health risk, but 500,000 women die from this every year. Let's hear from a couple of women, find out just how they've been affected by heart disease.
My event started in late evening on a Sunday. I was age 42 at the time, 8 years ago, and I experienced discomfort, didn't feel exactly right.
Well, I was 31 years old, and it was just a regular Monday morning for me. I thought it was maybe just heartburn, indigestion. I would not describe it as a feeling of, I'm having a heart attack. And it later kind of moved on to maybe I was having an anxiety attack or something.
So I asked my husband to call 911, and of course he questioned the need to do that. Are you sure? Because that's a serious move. And I said, I'm sure.
I got dressed and walked out the door and tried to drive to work. And on the way there, I became very disoriented. How I got from where I was at that time when I called her to my house, I don't remember. I don't remember, which was, kind of scary, kind of looking back at it.
I went from feeling poorly and like the elephant was on my chest to total nausea and also sweats. So I knew something was terribly wrong. And luckily, on the way, I was with the medic because I went into cardiac arrest on the way to the hospital.
They immediately saw me, and again they did the EKG and the oxygen level, and everything came back normal again. And then they sent in, the nurse to draw my blood. The doctor came in and said, "You've had a heart attack."
The good news is heart disease is largely preventable if a woman adopts a healthy lifestyle. That is, regular physical activity, eating a healthy diet, maintaining normal weight, and not using tobacco products. Then the number of deaths from heart disease could be reduced by as much as 50%. That's over 250,000 lives saved per year. Now let's go into a little bit more detail about what we mean by a healthy lifestyle. Your mom probably said, eat your veggies, and that is certainly good advice. Eating at least 5 to 9 servings of fruits and vegetables every day, along with a diet that's low in fat, sugar, and salt, and high in fiber, can help prevent heart disease and some of the conditions that lead to heart disease, like high LDL cholesterol and high blood pressure.
We really want you to take charge of your life and eat healthier foods. We would like you to have at least 5 to 9 servings of fruit and vegetables every day. We would like you to reduce the amount of fat and cholesterol in your diet, reduce the amount of red meats that you have in your diet, and increase your amount of fish and chicken that you have in your diet.
And get regular physical activity. Remember, regular activity doesn't have to be working out at a health club or running 5 miles. Regular activity includes walking for 30 minutes to an hour per day, and that doesn't have to be done all at once. You can take 3 or 4 15-minute walks. That activity can reduce your blood pressure and cholesterol as well, not to mention helping to maintain a healthy weight. And if you smoke, try to quit. Smokers and non-smokers alike should avoid environments like restaurants that allow smoking. Even exposure to secondhand smoke is a big risk factor for heart disease. Following these recommendations can help prevent or lower the risk of heart disease. But what if you have a family history? Or what if you have one or more of the risk factors we talked about, such as being overweight, lack of physical activity, or smoking? What should you do?
The body mass index is a number which can be calculated simply with your height and your weight in pounds. And I encourage all women to talk with their doctor about it and calculate their exact number. Because we know that if your number is greater than 25, you're at significantly increased risk for cardiovascular disease. And you should be setting a goal for less than 25 as your BMI.
as a cardiologist, I'm excited with all the new things we have that we can do for people. Medications that actually can reduce the chance that you'll get diabetes, that can help your blood pressure so much that you're less likely to end up with kidney problems, needing dialysis down the road. I would encourage you to take your problems to your doctors, remind them of your family history, make sure your blood pressure is being treated. Remember, a normal blood pressure is 120/80. If yours has been high for years, all the more reason that it needs to be treated and brought under control.
Smoking is also another significant risk factor that complicates the picture, and these particular risk factors, when you put them all together, certainly provides a very bleak outlook regarding cardiovascular complications. I see this every day. There are women, black women, Latino women, who are not able to obtain their medications, who just lack basic information about heart disease and the impact it can have on their life. And so it is very important that groups of women from particular populations like black women, like Latino American women, to become informed and to be able to access freely health care that would help them to understand the risk factors for heart disease in women.
Start by knowing your family history and know what the symptoms of a heart attack may be, and know what to do in case you or anyone around you exhibits those symptoms.
Women can experience symptoms differently than men when it comes to chest pain presentations. Most often they are similar symptoms. However, there are a number of presentations that women have that could be more typical for a female. It doesn't always have to be crushing chest pain or what we would call a Hollywood heart attack, but sometimes people just feel short of breath or an overwhelming sense of doom. Or just very significant fatigue that's preventing them from doing their normal work.
We do actually find that women as well as diabetics are not the typical cardiac patients. And so we find that a lot of times they'll call us for other problems. They'll call us because they have a jaw pain or their teeth hurt or they're just really weak. They start sweating for no reason. You know, delve into it a little bit further with your questioning and through your vital signs and through your EKGs and recognize this person may really be having a heart attack. Well, really 911 is for true emergencies, and we obviously consider a heart attack or a stroke a true emergency. The care that's going to be provided to you in your living room or in the back of that ambulance is the same care you would get in the first few minutes at the hospital, and actually will help speed your way through the process into getting the advanced care that you would need if you are actually having a heart attack or having a stroke.
The American Heart Association is really working diligently on trying to educate women about heart disease, about their risk factors for cardiovascular disease. We want you to visit our website, which is www.goredforwomen.org. You will be able to see what your risk factor is for developing cardiovascular disease, or if you already have significant risk factors for cardiovascular disease.
As women, we're used to taking care of everybody else, but when you take care of and love your heart, you can save it. If women make a promise to become heart healthy, we can reduce the incidence of cardiovascular disease. Then you'll truly have the time and the health to devote to yourself and your loved ones.